It's the most common inherited blood disorder in the world among people of colour.
The effects it would have on my whole body would be just not normal.
It's a disease that can cause sudden pain anywhere in the body, organ damage, stroke, sepsis, and even death.
She lived with so much joy and contentment that, in hindsight, I'm wondering, like, what sort of an angel was she?
We're talking about sickle cell disease.
Right now, billions and billions of red blood cells are delivering oxygen to all parts of your body. These cells normally look like round discs. But in sickle cell disease, they're shaped like sickles or crescent moons instead. They don't live as long as healthy blood cells and can block blood vessels. 22-year-old Reme Onolemenen was in the final year of her degree when she died from complications related to sickle cell disease in 2023.
For me, I describe her as a life-giving spirit. She was just full of so much joy. There's no way you can be around her and not laugh or not smile.
I suppose for me as Reme's mother, I'm so proud to have had Reme as a daughter.
It's estimated there are around 800 sickle cell patients in Ireland. Numbers have been rising as the country becomes more diverse.
I don't have sickle cell disease, but I do have sickle cell trait, which I inherited from my dad. I know this because I was born in the UK, where screening for sickle cell is included in the National Newborn Blood Spot Programme, or the heel prick test. But here in Ireland, newborns aren't tested for sickle cell disease.
Well, you see, the reason that you had your heel prick test or your universal newborn screening is because pretty much everyone has agreed that because sickle can cause death really in the first 3 months of life from infection, you do need to diagnose early. And there's a myriad of papers to say this. And most recently, myself and my colleagues in Europe wrote a document which was published in British Journal of Haematology in 2016 saying Europe needs to do this too. So actually fundamentally everybody else in Europe has now adopted that consensus document, except Ireland.
The HSE says it is working to develop a national model of care for people with sickle cell disease. This includes considering newer approaches to treatment, including stem cell transplant.
Sickle cell disease presents another challenge. Many living within the community feel that they live with a sense of stigma and feelings of isolation.
Former Miss Universe Ireland and social justice campaigner Aisha Akorede competed in the last series of Dancing with the Stars. She opened up about living with sickle cell disease and how she hoped to raise awareness.
My number one hope for the future is for there to just be way more understanding on all fronts. Hospitals, friendships, schools, teachers, workplaces, things like that, so that more people can, feel more confident to be like, yeah guys, I'm in a lot of pain right now because of this, or people won't feel like a burden either. I think that's the main thing, is the understanding is number one.
And on World Sickle Cell Day, that message rings out not just across Ireland, but across the globe.